Women are mothers, wife, they take care of the family. Their first reluctance in coming to hospital for surgery is that they have to be away from their family. And of course, the regular fear of pain, what will happen after the surgery, and all these factors. But the main factor that prevents them to take a decision for surgery is that they have to be away from their family. So when we tell the woman that you need a surgery, the first thing she asks, how long do I have to be in hospital? How long do I need bed rest? And when can I go back to taking care of my family or go back to work? And that is the reason why we try to do surgeries in a manner today that the patients need to visit the hospital minimum and stay in the hospital as minimum as possible, recover very fast without much pain, and so that they are able to take care of their families. Women by and large don't take care of their health as the foremost issue in their life. They always bring the good health or well-being of their children, of their husband, of their family before their own problem. So I find that women reach to us only when the problem is beyond what they are able to handle. So this is one problem, I think especially in Indian women, that they don't really come forward with their health problems very fast. One example I will give you of elderly women, especially the grandmothers. A common problem in women is postmenopausal bleeding. But many of these women will keep quiet. They'll think, oh, it will go back, let me not disturb my son or my daughter-in-law or my other family members for this little problem. But they must understand that this sign of bleeding in the postmenopausal age group can be a sign of uterine cancer. And if detected early, we can treat them completely. But many times we find that they come late. They have been having bleeding for maybe 6 months, 1 year. By the time they come to us, they already have developed cancer. So these are small things which women neglect, but they should come forward as soon as they form a problem, because the earlier they come, the better outcome we can give. Yes, to the young girls, I really want to talk about to them all the time. And this is one of the social initiatives that I take, that I actually take a lot of public related health talks to talk about it. The commonest problem that young girls walk into my office is some kind of period problem. And that is usually delayed periods, weight gain, and commonest diagnosis they come with already diagnosed, or they come with what we call as a PCOS or polycystic ovarian syndrome. What these young girls need to understand is polycystic ovarian syndrome, and that is why we call it syndrome, not a condition, because it's a syndrome of things which remain with the girls all their life. It is not that I can do magic when they come, give them one course of medication and they will become better. It is a lifestyle disease. It is something that is happening to our young girls because there is lack of exercise, there is a lot of pre-processed junk food in their diet, and they are obese. So these three factors, if they look into, most of them can actually improve their health themselves. So young girls must ensure that their weight is normal, which is in the normal BMI of something about 18 to 22. They eat right and they exercise every day. Today, in this era of everything online, everybody is sitting much more than what they were doing earlier. So we have to make an effort to exercise or to move around or to use our body the way it is meant to be. So this is something which young girls need to be aware of, because PCOD, they may come to us today with just period problem, but it has a long-term implication. That means it is associated with long-term development of diabetes, long-term development of other metabolic conditions. They may have ovulatory function problems, so that they have difficulty in getting pregnant. So it has implications for many stages in their life. So if they take care right now, they can maintain better health. Obesity is what slowly gets into us and we don't realize. By the time we realize, we have already become obese, and then it becomes very difficult to lose. So maintaining a good weight is probably one of the most important thing as a person you can intervene. Weak women often are because of development of anemia or other deficiencies, because the diet is not sufficient. They are probably bleeding heavily during their periods but ignoring that fact, and many times these women who have heavy bleeding leading to anemia and weakness can be treated by simple medication. All they need is to seek help at the right time. The other factor, the other class of women today are also the Google hunters. For a simple problem, they will think that the worst has happened, because they will look into so many symptoms and the Google Baba will give them an answer which probably is not true. So I would suggest that if you think anything is happening which is out of the ordinary, it is better to seek a medical help rather than take it with the fact that, oh, it may go away or there is something very serious to me either.